Okay, so hi everyone, am I audible? Okay, so we're starting the event now. Let me just take a second to talk about our organization. Um, so starting off the webinar. So HPHTO, we are Help People Help Themselves organization. This is our website. You can take a look at it. So the point of our entire organization is to advance public health awareness and transform lives through education and community engagement. So the whole purpose is to create more awareness about health education through community empowerment and youth leadership. Basically, create opportunities and empower people by increasing the amount of knowledge that they have about healthcare and healthcare related education. So by empowering volunteers to lead change, mobilizing health resources for communities, collaborating for health solutions, and driving awareness and advocacy campaigns. So, who we are? Discover Help People Help Themselves organization by going onto our website. You can check out our website. It's a very cool website. You can volunteer to join us and help out with conducting sessions like this. Also, to learn more in general about health education, and increase the amount of awareness in your community. So, it's an organization that's based in many countries like Sudan, India, Pakistan, Nepal, Nigeria, and more. We aim to become a catalyst for change in healthcare, take part in initiatives, and help spread vital health knowledge in places where it is required. Also, you can read various testimonials from different people when you go to our website about how the initiatives have positively impacted their lives through genuine experiences which have been shared by community members. So do take a look at our website when you have the time to, and help get involved, help us to change lives through health education. So um, with regards to this organization, we're going to conduct a five-part webinar series, the Global Health Innovator Challenge webinar series. So the objective of this webinar series is to provide attendees, you guys, with a deeper understanding of complex public health topics and offer guidance on crafting impactful research papers aligned with key themes of the concurrent change. So the more you know about these various public health topics, the better you understand them, and the more you can use them in your personal life, such as in writing research papers or just sharing that knowledge with the public sector. So coming to today's webinar, which is centered on the digital aspect. So today we have our guest speaker, Rejesh Bose, who's going to talk about the future of healthcare, and how the delivery will be digital, on how digital space is making much more of an impact in the healthcare sector in today's world. So if there's so I will talk about Dr. Rejesh Bose, Rejesh Bose, Director of Cure AI, for a second. It's a platform whose mission is to use AI to make healthcare more accessible and equitable. If the speaker is ready, then I can hand over the floor to him to take charge of the session. Sir, Rejesh Bush,
Yeah, yeah.
are you
Hi.
there?
Yeah. Hi. Thank you.
Okay. Yeah, I would like to give you the floor to conduct the session.
Yeah, I can get started. Thank you.
Yes.
Yeah. Yeah, I'll keep it simple. I mean, since it is a very diverse community and people from a different arena are speaking together, and I get to know more about the organizations. It's good to know the kind of work you're doing in the community, and especially for the youth and advocating public health and all the aspects. It's very great. I mean, young people like you are taking the change in your hands and take moving things up. So I'll get started. I mean, I've made a presentation and all, but I'll just go through it very slowly and try to understand. I mean, try to contribute whatever I can, but let's keep it as a long-term engagement. If there's anything at a later stage needed for anyone, also we are happy to support. So to give a very brief introduction of me, I am Rajesh. I work as a director of programs at Cure.ai. So I've been in the domain of public health maybe for last 7, 8 years. I did my after my public health from TIS Mumbai. So I'm kind of, I worked in different facets of public health, including non-profit, for-profit, health tech, health financing, digital health across the verticals. And today I've kept it very generic, very plain, not going to any health tech jargons or something, but keeping it very simple to the audience. So I'm just sharing the screen and getting things started. Let me know if you can see my screen. Is it visible?
Yeah, the presentation was visible.
Cool. So okay. So why, first of all, what I want to talk about digital health is why is digital health needed and what is the definition of it. So basically, we all know, right? I mean, it is not something very alienated, or maybe 20 years or 30 years back we were speaking about digital health. It may be something new or rare, but I don't think now there's anyone in this forum or anyone outside in the world who's working in the health spectrum who doesn't know about digital health. It Everyone knows it, everyone uses it. It's just I'm trying to put some context to it. That's only what I'm trying to do. So we have technologies, digital technologies and tools which are there available in the market, which are we are used by the hospitals, used by all of us. So those all, everything comes into digital healthcare delivery. So this starts from, an HMIS platform you're using in a hospital, or maybe an, portable wearable Apple Watch or something that you're doing, or maybe any, tracking, calorie tracking or step tracking applications you use. Those comes in the wellness domain. Some comes in the wellness, some comes in preventive, some comes in curative. Different comes in different segments. But anything and everything that, that uses the digital health data, or you works digitally to work towards the, healthcare delivery, is a digital health tool. So that is what we need to understand. And what is the scope of digital transformation, right? And this is like, there's a lot of things, right? I mean, it starts from, right now we are talking about large language model, artificial intelligence and everything. But what I again want to bring and build the context is, it's not very complicated. Anything that we use to simplify the current operations is a digital health, using a digital tool. So even if starting from a basic, application where we are entering data, or basic program, or we use to track our calories, everything comes in the digital health space. So, I mean, the historical perspective, it all started back in 1960s, where we started telemedicine as maybe the first way of digital health started. Then we had HMIS, health management information systems. Then we have EMR, medical records. So it has gone through. Now we are at a stage where robotic surgeries are doing, AI is able to diagnose, and precision medicines are doing. So that is current situation of, digital medicine where we are at. So, why is digital health necessary? That is was like, that's the question, right? I mean, we could definitely, there were time where we were able to do things without digital health also. So why is digital health needed is what also we need to think through. So one reason, which is like health systems across the globe, whether you take India as a country, or whether you take Pakistan, Nepal, Sudan, any country, right? I mean, the health across the world, health systems are very fragmented, and there's no place where, everything is standardized, or every the health system doesn't run that way, because end of the day it is ran by people like me and you, and it involves a lot of operations, a lot of mundane tasks, a lot of people at different knowledge level. For example, there are high end doctors to the, multi-purpose workers, MPH workers. So everyone is different. I mean, everyone's contribution is different. So since it is very fragmented, it also could lead to leakages, inefficiencies, and also there's also in turn effect in the patient experiences. Basically, think an example of hospital. So everything goes really well. The patient came to the thing. The treatment was good. Everything was good. But there's a minor error, like, the prescription the doctor gave is in a very bad handwriting. So that the patient experience has gone. He was not able to understand what has been written, or he didn't get the right medicine. Though the doctor is knowledgeable, everything was there, but some minor thing has caused an inefficiency. So that is where we fragmented health systems with a lot of mundane tasks cause health inefficiencies. So we wanted to address this to digital health tools. So that is where digital health becomes very necessary in the current world. Then the other thing is definitely, the burnt out hospitals, right? I mean, looking at hospitals or anywhere, right? We have a lot of people working in it, and the systems are very, very, very much burnt out, right? I mean, anyone you look, the nurses, doctors, everyone, I mean, there's a lot of operations they're doing manually. There's a lot of work they're doing manually. So to ease this, so how digital health tools can help? For example, if someone is writing a prescriptions or someone is entering everything data manually, and this takes their time, this makes them more burnt out, and also this is also at the cost of getting a better treatment or better patient experience. So this all of this burnout in hospitals and the kind of mundane tasks they are doing also brings to the need of digital health, why it is necessary and all. Then third and most important thing is the data, right? Dependency of data in healthcare. Empirical data is very important, and we do need to have a lot of data, and this data has to make sense for many people, including pharmas, or including corporates, or including hospitals themselves, and the epidemic angle of it, government's needs. So all this data cannot be processed with manual processing of this data, and making sense is not going to work out. So that is where we have big models, big data analytics we are doing, and that is also one version of digital health. So these all are what I'm trying to say. These all are different facets which causes a need for digital health overall. That is how it is. These are the basic areas where we say that why digital health is important at current world. So just for the bandwidth sake, I'm just turning off the video. So, but let me know if there's anyone have any questions or something. Okay, so we start with telemedicine. So telemedicine is like something which is very solid, and everyone knows during COVID time it was very helpful. So where it has, the major thing is it bridges the gap between geographies, right? If someone is sitting in a village in Maharashtra, the doctor is available in Tata Medical Center in Mumbai. So telemedicine enables the connect with them. So, and we do have high-end cameras and everything currently available. So it is the definitely the presence of the importance of touches being missed, but still a virtual consultation is able to done remote diagnosis, treatment, patient counseling, and definitely there would be a doctor at the other end also. It's not, it's always best when a general physician sits with the doctor in a remote location, and he is connected to a specialist doctor at a different location, which where telemedicine enables it. Even government of India has a telemedicine platform. Many governments are doing it. So this is where the virtual care is one of the major aspect of digital health, which is very well equipped, which is very well regulated right now, and which is right now, which is everywhere available also. And this helps the across the boundaries. People can seek help, people can take their opinions, and all that sometimes we need is a good reliable internet access. And we as a world, we have progressed. Even all the third world countries also do have really good internet access, which enables it. Then this is something, definitely again it comes to digital health arena, where wearable health techs, which is again we all uses it, right? End of the day, we are like the young crowd is a very good subscribers or consumers of these things. So this includes, starting from our smartwatch, fitness trackers, and also the glucose, tracking things. So everything, whatever you are wearing, whether it is for a preventive aspect or curative aspect, to to monitor your health, to give your health information, to monitor and get to drive you to get better health system, better healthcare, better treatment. Everything is comes under the digital health facets. So that is why wearable health techs are also falls in the digital health arena overall. Now coming with whatever integration with healthcare system. So what one is something which we need to, I mean, right now what is happening is, right now all this we all uses watches, that thing, everything, we all our data is recorded. But where are these going? These are never coming to the healthcare system. That is big gap which we need to address, or maybe in the coming years there would be regulations coming into it. For example, putting more context to it, you may use an Apple Watch, and you may be your heart rate is relatively slower, but you only know when you look at the watch, maybe Apple has that data. But whether that data, how are we going to regulate and get that data get integrating to the health system, which is, suppose India, or India as a country we are asking, where is like how this data can help you to get better treatment or better information from a regulated health system. So that is what next steps which we're going to do, or which we are in the future which is going to come. All right now this market is not very well regulated. So that is why a lot of companies, starting with very small companies, anyone who knows to make these chips and boards, they are making these watches, or all those things are coming into market. But soon this would be very much regulated, and it would be, this data would be regulated, and it would be integrated with the health system. Now coming, the current thing, right? I mean, which everyone is very well aware. And when I work with an AI company, where what we use for artificial intelligence and machine learning, so it's nothing more than that. I mean, it's more of, you have a lot of data. So this data has to be used to something meaningful. That is what artificial intelligence and machine learning does it, right? And you think of a scenario where, you know, there are, like, different people's heart rates are available, there different people's ECG readings are available. So we, like, when you collaborate or you culminate all this data together, we understand which all are the cardiac arrhythmia cases, or the cases where there is anything wrong in a patient, how the ECG looks like. So this data is available, and it is more standardized, and it is scientifically proven. So now, with this available existing data and information, we make digital tools, or we make artificial intelligence tools, which can help, hospitals to consume, health systems to consume, and use it for the enhancement of medical care. And also it can be used for the personalized medicine aspect. So that is what AI is doing. I also work with a company where we, do a lot of chest X-ray screening and understand tuberculosis screening and lung cancer screening from the data available, and we make algorithms and models which can basically screen lung cancer and tuberculosis from chest X-rays. So similarly, a lot of models, a lot of companies who are working into this, and anything, this products or this software, end of the day, has to work with health system, and this will be regulated, and this has to go through the regulatory aspects of respective country and the region they are operating. And this is like health tech, as you all know, right? It is one of the current boom, in the digital health aspect, where there's a lot of funding is coming, a lot of career is there built around it. All those things are coming. Then personalized medicine, some of you may have heard about it, right? Genetic informations. We are getting the genetic information of the patient and understanding the genetic devices and getting the personalized medicine. This is also something which is very much coming into the digital health aspect. There are genomic companies who are currently working in it as well. And then AI can also automate, routine administrative tasks, right? Medical coding, billing, scheduling. For example, take supply chain as a department. Previously, this used to be like, different, any vendor who give, we have to always look which vendors the price is lower, who is giving quality product, all those things. So now there are AI tools to, look at the history of the vendor, look at the quality of product, look at the price of product, and enable the decision making faster. So automating administrative task is something that has been doing by AI and AI tools across the world. Then diagnostic accuracy, which I also mentioned in the beginning, my company also works in this area, and there are, diagnosis is very foundation of healthcare, right? Whether it is point of care diagnosis, whether it is through X-rays, whether it is through lab test. So all these diagnostic accuracies consider a system where, if you recall what I said, doctors are overloaded, burnt out, and in settings like third world country, there's a lack of availability of doctors and good healthcare professionals. In these cases, all these diagnostics tools can help and aid the people or the doctors to diagnose faster and diagnose accurately. So that is also one area where AI and ML is heavily contributing. So why do we need? I mean, in the beginning we mentioned about the, supply side issues, but again, I mean, why we what is the impact on patient experience? So how is digital health going to do that? So one is definitely it bridges the geographical gap. So for example, even this session we are all are talking because of internet and which make us connect. Similarly, we when we have a digital health, any like anything, right? Anything which is digitally we are able to do it, and when anything digitally created, it is there forever, and it can be scaled to any across the boundaries, across the geographies, and maybe in soon future across the planet. Right now, all the communications are within Earth. Now we will soon have, like, we'll have, like, if there is someone is going and we have new planets coming, and we always have the communication. If the doctors are available in some other planet, all those things will be able to do that. So that is where the geographical gap. Right now, the issue is with mostly within urban rural gap is what we are facing in most of the countries, where there is a lack of facilities or lack of specialists in a rural side, where from a very public health lens, which can be bridged by digital health tools, including the telemedicine and all the accesses. So basically, access can be built. Improved accessibility and improved convenience can be done by digital health. Then yeah, then the flexibility on time, right? I mean, you don't need to always dependent on, like, suppose you are someone who go for you have a manual job which you has to go to morning to evening. So and digital health makes you enable to connect to a different doctor in a different time zone or a different comfort zone, different this thing without deviating your other normal job. So that is also on demand consultation is also very much convenient standpoint of where we digital health can do it. This we already mentioned about this. So there are patient engagement, there are health apps and portals which example helps to take appointments, access personal records, all those things. And also we have patient education and support tools. This is also where the LLMs, chat gpt and large language models going to work. This is also not very regulated, but soon there would be like regulated tools. Right now in mental health space there are a lot of digital health companies where you can seek counseling over chat or get a person. But again, it's all comes with a risk. Right now we have to always assess the organization or the product is regulated or and which is safe to use. But this is the direction it is going, so we always have patient education and support tools which can be used for these things. And also this is already we discussed, all digital health enables the feedback mechanisms, real-time feedback mechanisms which can be done at those things. Then quality of care, enhancing the quality of care, also data driven treatment plans. Right now anything what is doing or what is something that is being treated, so with the help of digital health we can look at the data. For example, taking just putting an example, so for example a patient has come to one hospital and we are seeing something interesting in his thing and he needs a immediate care. But if digital health is very solid and it is communicating across the health system, in one click we can get to know all his previous history, clinical history, family history, and also all his health records which he has gone into other hospitals. That is where government of India also is coming up, integrating it with Ayushman Bharat health, ABA cards. They are doing it. So that way, I mean, this is a direction we are going in. So this data-driven treatment plans will intense and will become more stronger in the near future. And this is also just though we talk about digital health a lot, but there are some areas of digital health is very matured and very very solid to use. Those are our EMRs and HMIS platforms which are using currently. But the AI and where the diagnosis are using patient data is being handled, there are some areas are not very matured, so those areas have some challenges and concerns. So that is where we just will talk about this. So one is definitely regulatory compliances, which I said. So end of the day, these are handling patient data. So there are regulatory compliances which across the world has to be done. GDPR compliance, HIPAA compliance. You can read about it, and this is very universal. And apart from this, there are country-wise or region-wise. For example, European Union has different set of regulatory compliance, CE clearances, FDA clearances for United States market. So all these compliances, because the patient information is handling, this has to be done. Because end of the day, we as an individual, our health data is ours. We have to respect that. We have to take ownership in that. It's not for any other company or anyone to come and take it and consume and make it commercialized. So that is why these organizations and these agencies are in place. This is also something which is a big challenge, because when companies come to play in this, they also have to get this regulatory clearances and across the borders to work and make it fine tune the product and services. And then, yeah, protecting patient information. End of the day, I mean, recently I've read a news where in Turkey, like there are someone who hacked the patient information and from the government systems. So that is like, when you talk about digital health, it's my responsibility. If I am running a company or you have any digital health diagnostics tool you are doing, you have the responsibility of protecting your patient's data, and you have to design it. You have to have an architecture for this. You have to have an infrastructure for it. So this is not everyone has it. Not everyone who has a good idea has it. So that is also one of the current challenges which we are facing with digital health companies and digital health as an ecosystem overall. So this, I think, we overall we discussed, right? What the adoption barriers, right? There is cost coming to it, because if a product is very priced, I mean, not all the markets can use it. Maybe Western market can adopt it quickly, maybe Arab markets, but low and middle income countries may take to time to get it into their health system due to the cost, due to the infrastructure they have. Some of them do not may not have a high end computers to handle this product. And also then definitely very cognitive challenges like as training and adaptation. Doctors are already busy, or the healthcare staff is already occupied with a lot of other things. And anything that we are being introduced shouldn't be taking more of their time. They should feel easy about it. So if that is not happening, or if they have challenges which happen, people don't necessarily, not everyone likes that challenge, not learning new things and adopting into it. Because if someone is comfortable in doing what, they continues to do that. That is where this resistance to change comes. This is also one of a very classic situation faced. So if you know someone who works in an HMIS companies or EMR companies, whenever the software goes upgrade, you can check with them. When they go live, they have to spend days and months in the hospitals, these companies, and make sure every user is trained and they're getting comfortable using it, entering all the data. Because any minute change in these things, which will cause a lot of inconvenience. We can think, right? Even Instagram changes in any of their update, they change some features. It will make us a little discomfort. So you can think when it is as a part of work you uses it, how difficult it's gonna be. Then the ethical and legal issues. This is like maybe like not always we are in a position that not all the companies the consent, because patient is sharing his data to a cloud or someone to process. So we have to have a consent and informed decision making happening. So who owns this data, who's giving the consent, whether it is hospital or patient, and whose liability and accountability it is. So these are also the some areas where digital health is still evolving and still has to be regulated, and this is still working out. Yeah, this is again, I mean, what is the future direction? So, future direction is, as we all know, it's mostly on. So, I'll quickly run through it just considering the time. So, future direction is one thing which I already mentioned, that we want to integrate it with everything and anything within the healthcare system. But there's no use operating this digital health in silos and adding value to it. But this value addition can be doubled or multifolded when they integrate it to the health system. So that is what we will need to have, like all the medical devices, all the portable devices, everything has to come into a situation where they are ready to integrate with the health system, and there should be an interoperability between these things, and data sharing platforms should be enabled. Then the other thing is, like, definitely, I mean, right now we are still running on more of a curative side. We still can, we couldn't predict COVID. I mean, you can think of things, right? I mean, 2020 is well advanced. It's not very old. So we should be able to, our data should be able to make that when there is going to be an outbreak. I mean, just like, police and all work, they have an intelligence bureau who says there could be a terrorist attack. So that way, there should be, we would be able to, our health system should be able to predict this health attacks or health trends, which should be by getting the necessary existing data. This is also not, we haven't reached there, but definitely this is a future direction we are going, and we are reaching, and there is a lot of R&D, research and development going on in that direction as well. Then robotic surgeries are currently happening, but not scaled to all part of world, and also only limited to few surgeries. So that is also one line. Then streamlining hospital operations. To an extent, private hospitals has used AI and a lot of digital health tools and streamline their operations. But across the world, the government hospitals are still relying on a lot of manual things. So that is also one direction where slowly we are moving towards in the future, and getting these operations more concrete and more streamlined with using digital health tools. And this is again repeating, and like now we'll just quickly, I mean, what is career, right? I mean, career angle, we all like are very interested to know. So I was just thinking of what is for career in digital health for anyone, which we need to know. So one is, it's very broad, it's very wide. I mean, whether you study engineering, you study public health, you study medicine, whatever you study, you all have something to contribute. It is not something that is very confined to some people who did something, some program or something. So it is very, everyone has a role in it. So if you think from a product life cycle or a digital health angle, so there are engineers and coders needed to build these solutions, and there are people, managers, and professionals who can, we call product managers and all those people. So they have to customize, manage the thing, understand the product, guide to the engineering engineers and the builders and developers. So that is a different, that's another set of job prospect in digital health currently having it. Then another thing is democratizing and implementing them. People who knows health system, these are where doctors and public health professionals and all come into picture. People who can make understand health systems and position this digital health tools into health system. For that, they need to know the governments, they need to know the people who uses it, they need to know the hospital operations. That is a different set of career arena which is digital health is opening. Then another one is scaling and selling it across health systems and corporates and companies. So end of the day, you're like selling is a skill. So if you can sell anything, you can sell digital health solution also. Then that is also a different arena, different career prospect digital health is opening into up to the world. Then marketing on it, researching on it, and doing, because anything in healthcare needs empirical evidences, so there's a lot of importance for the researchers, that whether it is in health economic research, whether it is in cost benefit research, whether it is like randomized RCT studies. So a lot of scope for research is also in the digital health, which we needed. And then the regular marketing people, finance people, legal people, because these are organizations end of the day. So these all need all the all the support systems to run it. So across the career aspects, there is something for something in digital for the digital health for everyone. That is what I just want to highlight on a career aspect. So I'll pause here because considering the time and all those things, I'm just taking a pause here, and I'll just open the tab for questions.
Yeah, so there were a few questions that I received in the chat privately. So should I read them out to you?
Yeah, yeah, yes, please.
Okay. So you talked about bridging the geographical gap in your presentation. So
Mm.
someone said this whole AI consultations, telemedicines, and online methods, how can it ever replace the face-to-face connection that a patient has with their doctor?
See, we are not replacing anything, right? We cannot replace that. That's very understood. I mean, the idea of any digital health tool is to replace what it is existing. It is just making an extra edge of it, right? For example, what you want a patient a cancer patient who is in some part of the country who do not have an oncologist in his village or community, who get a chance to talk to a doctor in an oncologist who's based out in a hospital in some other part of the world. So just because you don't have a face-to-face interaction, you don't want to let it go, right? I mean, because when there is an option, so you are not getting 100 of it, but then you take 70 of it, then you make a way out of it, because because healthcare, because we have to take progression over perfection any day. We have to, because healthcare, you cannot wait until the patient gets into a very bad state. So the very next immediate chance you get to talk to the concerned specialist, you make it happen. That is what telemedicine does it. And during the time of COVID, across the globe, we were able to do that. I mean, it's definitely we cannot do surgeries, we cannot do a lot of things, but there are things we could do it. And it is more about understand. I mean, not everyone needs. I mean, you have a wart in your skin. I mean, you cannot, may not be. I mean, if you show it over a screen, I mean, I show my hand, I mean, you won't be able to understand what exactly. I mean, that is a different story, right? So there are areas where we could do. Then yeah, that is how, like, so that is why, that is the important. It's not replacing the touch or face to face thing, but it is addressing the need and making a solution to it.
Yeah. Also, what about people who are older adults or are less tech savvy? How will they be able to enter into the digital healthcare space?
I mean, in career or in into or in using
Patients,
patients.
patients.
So one is this should be facilitated. I mean, it is not. I mean, it's like the idea of anything in healthcare is like not for us to self-consume, right? Whether if it is no one recommends in healthcare. You Google your symptoms and start treating yourself. So the idea is health system is always facilitated and driven by health professionals. So the idea here is if someone is old aged, the health system, what I meant is it includes the doctors, nurse, everyone. They should facilitate it, and they should help. I mean, it is not that is one thing. They should be able to facilitate it. And so if you have a small sub center or PHC near to you, and you go there, and they have the responsibility to facilitate this digital health to it. And also another thing is, we little undermine our age people. I mean, they are also good enough to use our basic tools, right? Even if it is a wearable tool, and even if it is a mobile
Yeah,
app, they may take more time than you, but that doesn't mean they won't understand it. I mean, that is something very comes from us. So it is also, if someone who can do it on their own, well and good. Otherwise, we have to facilitate. I mean, that is where volunteers, people, health systems, everyone has a responsibility if someone is not able to do it. For example, I'll tell an example. So where when this Aadhaar, like the card, right, Aadhaar card has to be taken. They take this finger. There are like some fingerprints and some people. So when you are very old, this data you cannot take it in the normal machines. So then, like for only for those that was not known in the very beginning. But later, the government has come to know that with the current infrastructure, you cannot that. So for those very old people, then they stop taking those things because that is not recording it. So we have to figure out way when we go through that situation, we iterate, reiterate, and we come up with solutions. The idea is everything we do is to enable something, not to block something. And all
yeah,
people,
that was a
yeah,
great answer.
They will have challenges, but yeah, we all have responsibility to how are they gonna find answers. Yeah.
Yeah.
Anything?
Uh, yeah, also, since this new digital health, telemedicine, telecommunication involves such high technologies and artificial intelligence, machine learning, it will also cost much more than an average face-to-face consultation. How will people deal with the rise in Medicare cost?
Very, very interesting question. So, see, health financing is altogether a different angle, right? So, you look at different countries. So, for example, take United States of America as a country, and UK, I mean United Kingdom and the NHS as an example. So, these two countries has a very different perspective to their healthcare treatment. US, it is insurance driven. You have to have an insurance to get all your treatment. Or otherwise, if you are not able to take the insurance, you will have Medicare and Medicaid, which was previously called Obamacare. I mean, which is
Yeah,
an social support by the government. And in UK, NHS has the responsibility of treatment. If you are, whether you are expat, you are working, you are a migrant population, NHS has the responsibility of treatment for everyone. So all the cards are made, and the treatment. And in coming back to India, it's fragmented. I mean, it's there is a private market, there is a public market. So whether you can, you can afford an health insurance, you can take an health insurance and do the treatment. If you cannot afford, I mean, you have the public facilities which is already there, which is, so it's a mixed health system which we are seeing in India. So the idea is health financing or like health costing is always a regulated thing by the governments. I mean, the political governments has the responsibility, like of the rising healthcare costs. One, there should be clear regulations on capping the pricing. So you cannot charge because you are giving an digital health service. You cannot charge beyond it. There should be capping by the government. There should be capping by the regulatory authorities. Second thing is, like one is more penetration of insurances, health insurances, private and public. If like there are government insurances which is like called Ayushman Bharat, Pradhan Mantri Yojana, and all, and every countries, right? I mean, every country there are social security tools which has to cover this for the population who are vulnerable and who has affordability issues. But sometimes the coverage of these programs are not what we think, because there's a clear information asymmetry. So maybe, I mean, organization like yours, right, and you can take a gap in making sure more people knowing it, more community knowing it, and including community leaders, including people from like being self-help groups, like making the power, right, change the decentralized things, making more people knowing and getting the services. So that is what I mean. Health financing is a global issue. It is everywhere. The ultimate people to answer and find a resolution is the government, but we all can have our bits to do, and we can do that. And every government, I mean, every country has a different aspect to it. And it's a never ending topic. So for example, you take Arab countries, I mean, the health system, like, it's very, very expensive there. I've seen like people traveling to India and getting their thing done. I mean,
yeah.
even if their to and fro flight cost is also not nothing, I mean, comparing to the pricing
Mm.
there. In US, it is very much insurance driven. You cannot survive if you don't have an insurance. And but India is currently, from a health system angle, countries like India or Pakistan, Nepal are like in a very comparatively better state. You can afford, you can take an insurance. You cannot afford, you can go to the government, and you have a social security tools also. But what we are missing is the information symmetry. Not everyone knows about everything. That is where we need to focus.
That was a very thought-provoking answer. Also, we have one last question. Is that how can smaller or rural healthcare providers based in rural areas, afford to adopt and integrate these advanced digital tools into their daily practice?
That's a very good question. So see, one is, like, if it is a private hospital, or if a private hospital is covering to a rural catchment area, and they want to adopt them to these things. One is, we need to, I mean, the organizations need to, organization or the hospital or the practitioner, someone has to volunteer and reach out to the organization who does it. And it all starts with a basic Google search. I mean, I would say it that way. Then you understand the companies who are working on it, and reach out to them, ask for tell your case, right? I mean, you have you have whichever geography you're working in. So including company like mine, I mean, or any companies who are working in which cause you want to work on, understand that, prioritize your area of therapeutic your therapeutic area, and you reach out to those companies or those organizations who have a digital health tool on it. One is ask for a pilot or something, that if you have an affordability issues. Other thing is reaching out to philanthropic organizations and ask for a support of a grant or something where they can support this, NGO or hospitals has an affordability issues, and do that. And this has to be done more, like more programmatically. We cannot, we have to have understand who can help it, and ask for it. And sometimes, this is also the whole idea of digital health tool is to bridge this gap. But as the question, the people, the person who has pointed exactly, not always it bridges that gap. So there should be a very proactive approach from the person who want to use it, and they can use it. I've seen, like, when we Cure.ai, my company, we work in very rural pockets of India and world. We have districts in Nagaland uses our product. We have in different part of Africa, our products being consumed, which you cannot imagine. So, and like, that's utterly remote. So that what I'm trying to say is, where there is a will, there is someone there is ready to adopt a technology. The technology can reach out to you.
Okay. Thank you so much. Thank you so much for reaching out to be a chief guest for today's event. We learned a lot from today's session.
Yeah, cool. I'm happy. Anything else? Any final comments or questions? So then,
No, there are no more questions from the chat. Thank you so much for
cool.
today's session. It was
Thank you,
really
everyone.
helpful.
It was, yeah, my pleasure. Yeah, thanks. Thank
Yes.
you, everyone. Bye.
I'll wrap up the session by saying that this was part one of our public health webinar series. We're conducting four more parts, if I'm not wrong. Do attend part two, three. If you attend three out of five parts, you will receive a certificate. But also make sure to attend all five parts because we have some amazing sessions coming up for you guys. So thank you so much for today's
Thank you.
session, sir.
Thank you.
Thank you everyone for joining. It was nice meeting you.